the American Academy for Yoga and Medicine presents the Integrative Medicine Research Festival. Join us for an insightful webinar, Advancing Lifestyle Medicine Through High-Quality Research, Principles, Pitfalls, and Possibilities, with esteemed speaker Dr. Supriya Balarao. Explore the evolving landscape of lifestyle medicine and discover how high-quality research can shape its future. Don't miss this opportunity to learn from one of the leading voices in the field.
Good morning, good afternoon, good evening, everyone, and welcome to today's webinar. And I'm your host, Aditi, and it's my absolute pleasure to introduce our distinguished speaker today, Dr. Harminder Grewal. She is a highly respected physician, educator, and leader in the fields of family medicine and integrative medicine. She currently serves as the chair of Department of Family Medicine and is an associate professor at Wright State University, Boonshoft School of Medicine. Additionally, she also leads the whole health clinical lead at Dayton VA Medical Center, and she's dedicated to enhancing veteran wellness through holistic approach. Her extensive clinical experience spans across USA, India, and UK, with a specialized training in family medicine, integrative medicine, obstetrics and gynecology, and pediatrics. As a board certified family medicine and integrative medicine practitioner and a fellow of American Academy for family physicians, she brings a wealth of knowledge and expertise. Throughout her career, Dr. Grewal has made remarkable contributions in leading family medicine residency programs, pioneering rural residency initiatives, and advocating for comprehensive women's health care. So her dedication to well-being of both her patients and her community is truly inspiring. Please join me and welcome Dr. Harminder Grewal. Thank you very much for coming.
So much. Thank you so much, Aditi, for your kind introduction. I'm honored to be invited to the festival, and I am so glad to hear and see that so many of my colleagues are interested in a more holistic approach to healthcare, as we know that it's sorely needed at this time. So the topic of my talk today is whole health system of care, a new paradigm. I do call it a new paradigm, but it is a very old paradigm, but there was a hiatus in between, so now we call it a new paradigm again. So the objectives of the talk is to understand the whole person care models and reasons for their creation, learn about the 8 circles of well-being in whole health, learn the differences in integrative medicine, lifestyle medicine, functional medicine, and whole health systems of care, learn about the research to support implementation of the whole health system of care. What is the current status? So the current status of healthcare delivery is not very good. It's ineffective, it's costly, we can't sustain it. Nowhere is it more obvious as the management of chronic pain. And, we have had an epidemic of opioid overdoses, opioid overuse, benzodiazepine overuse. Patients are not actively engaged in their own well-being because we made them so dependent on pharmaceuticals in some ways and devices. And, people just did not understand that our body has the ability to heal itself innately. What are the problems with current system? Conventional medicine is crucial and beneficial, but can be costly, invasive, often focuses on the symptoms rather than the whole person. All our specialties are based upon what body organ we are looking at, a cardiology or neurology or, GI. So we are just kind of focused on organ systems because it's easy for us to understand because anatomy we learned first. So that's why it's sort of developed in that way. But truly, a human body doesn't behave that way. It's a sick care system which has incentive not to support well-being. We are great at acute care. If you break your bones, we can take care of it. And, somebody has acute appendicitis, ruptured appendix, we'll take care of it. But other things, you have chronic illnesses, good luck. Many powerful lobbies in healthcare which support status quo. Pharma, of course, wants us to dependent on pharma because that's how they make profit. Hospital systems, they like people to be sick and hospitalized, so they have incentive as well to maintain the status quo. Device companies, they want more devices in people's bodies, so no wonder, they have a lot of money, they have powerful lobbies. We have a poor payment structure which rewards procedures a lot more over cognitive work. and the cognitive work is what creates wellness. We have to work with the patient, engage the patient, and, help them get to the paths to wellness. Poor health equity, people who are rich can have better health than people who don't have the resources. We have lack of universal health insurance. We have a fragmented healthcare system with extreme complexity. Nobody can understand it, so they can't fix it. We're very wasteful, high overhead costs. Interestingly, in United States, our overhead is 5 times that in Canada. I could not believe the number when I heard it. Consolidation. A lot of things are the bigger companies are buying, they're consolidating, which is leading to even higher costs, as we know. So here is the information a little bit about.
Can everyone mute yourself, please? Harshita, can you mute yourself? Okay.
I muted them, so it's okay. So there is a global burden of disease, as you can see in this slide. This is from Institute for Health Metrics Evaluation data, very recent data. If you look, there is a lot of if you see this whole area here, which is in the purplish blue, this is high body mass index, hypertension, high LDL, high fasting plasma glucose, low physical activity. All these are very amenable to lifestyle management. And the ones that we see in the other side are, if you see the youth, you see some of these like malnutrition. Again, we have dietary interventions which are going to help with that. And let's go to the next slide. This is the other one, which is again talking about hypertension, high fasting plasma glucose, tobacco use, dietary risk. All of these are amenable to lifestyle changes. What happens in chronic illness? Loss of self. It leads to more restricted lives. It leads to social isolation. Our people feel discredited. They feel they're burdening others. So this is a major issue that we don't even pay attention to, as to what is the mental burden of chronic illness, and this is what we are facing. Whole person health. What is it and why is it important? Whole person health involves looking at the whole person, not just separate organs or body systems, and considering multiple factors which promote either health or disease. It means helping and empowering our individuals, families, communities, and populations to improve their health in multiple interconnected biological, behavioral, social, and environmental areas. So instead of just treating a specific disease, whole person health focuses on restoring health, promoting resilience, and preventing diseases across a lifespan. So this is exactly from NCCIH, which is the complementary and integrative health part of National Institute of Health. So this is these are elite research bodies in the United States. What are the whole person care models, and what is it and why is it important? Again, if you look at here, these individual are biological, behavioral, social, and environmental factors. And we have the family, which comes, then we have the community, and then we have the whole population. Everything affects our health. And here is health and here is disease. And as we maintain that, the health of the individual, family, community, and population, we improve individual health at the same time. Why is whole person health important? So health and disease are not separate, disconnected states. Yeah, they are in a path which can move in 2 different directions, either towards health or towards disease. Many things affect our biological makeup, some unhealthy behaviors such as poor diet, sedentary lifestyle, chronic stress, poor sleep, and many social aspects of life lead to chronic disease of more than one organ system. That's why just one organ system treatment is not going to help it. Self-care, lifestyle, behavioral interventions may help with return to health. Chronic illnesses, diabetes, cardiovascular disease, obesity, degenerative joint disease, also occur with chronic pain, depression, opioid misuse. All these things are interrelated, and they're all exacerbated by chronic stress. So understanding the condition which somebody has lived, addressing the behaviors at an early stage, and managing stress can prevent multiple diseases and can also restore health and stop the progression to disease across somebody's lifespan. Is it right now being used in healthcare? I'm talking only about United States. So this data is from US. I'm sure there are whole person care models being used in European countries or other countries. So VA's whole health system of care and whole health approach, which started in 2015, is the biggest system because VA is all over United States, and it's the largest healthcare system in US. Total Force Fitness Program within the US Department of Defense military health system is another one, which it started, I think, in early 2000s. I think 2009 is when that one started. Whole Health Institute's Whole Health Model. So this is an institute which has been developed not long ago. So 2020 is when this model developed. North Carolina Department of Health and Human Services. North Carolina is one of the states in the United States that decided to go, totally into whole health. The Ornish Program for Reversing Heart Disease. So this is research-based program which includes not just exercise for cardiac rehab after somebody has a heart attack, but it also includes meditation and dietary changes. And it has been shown to reverse heart disease, and now it is approved by Medicare for cardiac rehab. What does research show about whole person health? So many benefits, healthy behaviors, environments, and policies to maintain health, prevent, treat, reverse chronic diseases. We have major studies like Framingham Heart Study, Nurses Health Study, Adventist Health Studies, which have evaluated interconnections between lifestyle, diet, genetics, health, and disease. We don't have as many randomized control trials because it's very difficult to do that, when you have so many variables and so many, multi-component interventions in a whole health system of care. But VA has decided, to do some epidemiological evaluations, and they are quite compelling, which I'll be sharing in after these slides. So challenges come with conducting this type of research with finding appropriate way to assess the evidence. So, but again, now opportunities are emerging to explore new paths towards reliable, rigorous research on whole person health. The case for whole person integrative care. So this is a paper which was published in 2021. And this is coming from the private sector, not from the VA. So there is need for medicine to deliver more whole person care. This is a narrative review of several models of whole person care and studies which illustrate the business case for whole person models in primary care. Conclusion was that evidence for the benefit exists, but definitions are heterogeneous and unfocused. So we need to have a little bit more focus on what does it really mean. And there's need for more standardization of the whole person models and more research using these approaches rather than separating out each component and trying to do a reductionist approach. Well, this particular thing works or this particular thing works. Instead of that, we have to see if the whole model works together. We'll talk a little bit about historical perspective behind whole person care models. And this is going to be interesting. So, as we know, early 1900s, 1910 Flexner report came after that, and the Rockefeller, and some of the other, very, I would say, influential bodies in the United States decided to standardize medicine. And I think that is where a lot of the people who did somewhat more eclectic work, people who were kind of doing manipulation, who were doing, we would say, drugless therapies, those people were sort of pushed out of modern medicine. And that continued for quite some time. Over time, United States had development of naturopathy, had development of chiropractic, so all those developed. And then, so some of the newer approaches are the integrative medicine, which developed in 1990s effectively, more so, but the seeds were sown earlier than that, probably 1970s. So integrative medicine is defined by consortium of academic health Centers for Integrative Medicine and American Board of Integrative Medicine is the medical practice that reaffirms the patient-practitioner relationship, focuses on the patient as a whole person, arrives at conclusions based on evidence, and uses all therapeutic approaches, disciplines, and healthcare professionals to achieve optimal health and healing. So what we are doing in integrative medicine is that we are being more inclusive to evidence-based therapies from every kind of pathy, whichever it may be. It could be Ayurveda, it could be homeopathy, it could be naturopathy, it could be chiropractic. So this was the definition from American board, ABPS, American Board of Physician Specialties. So integrative medicine uses an evidence-based approach to treat the whole person, your mind, body, and soul. Your physical, emotional, mental, spiritual needs are all involved. So integrative medicine uses combination of therapies. So integrates conventional approaches and complementary approaches to achieve optimal health and healing. So this is Cleveland Clinic's definition. What are the 8 defining tenets of integrative medicine? So patient practitioner are partners in the healing process. So all factors that influence health, wellness, disease are taken into consideration. So mind, spirit, community, as well as the body. Appropriate use of both conventional and complementary methods facilitates the body's healing. Effective interventions that are natural and less invasive should be used whenever possible. Integrative medicine neither rejects conventional medicine nor accepts complementary therapies uncritically. So basically, you have to look at the evidence in both. Good medicine is based in good science, so it is inquiry-based, open to new paradigms. Along with the concept of treatment, health promotion and prevention of illness is very important. We shouldn't have disease to start with. And practitioners of integrative medicine should exemplify these principles and commit themselves to self-exploration and self-development, which means it's a constant learning process. So again, strives to merge the most appropriate conventional treatments with complementary strategies. Foundation. So we talked about a little bit of history, right? So long history of healthcare healing traditions in the world. Healing traditions in the world are before Christ. Look at Ayurveda. It's so old. Same way for Chinese medicine. It's really, really old. But just I told you the story here, in early 1900s, we had total monopoly of AMA-led, changes, and that led to, I would say, sidelining of some of the integrative approaches. 1978, American Holistic Medicine Association was formed. 1979, American Holistic Nurses Association was formed. 1991, first complementary medicine program in University of Maryland. 94, Andrew Weil Center for Integrative Medicine. So Dr. Andrew Weil is a Harvard-trained internist who basically said, hey, what we are doing is, I don't think it's working, And I think he is the first person who went against the, regular way of working and said, we need to look at everything that works. And he was a big fan of breathing exercise of yoga. And so American Board of Integrative Holistic Medicine, ABIHM. Then Dr. Andrew Weil started the first fellowship program in integrative medicine at University of Arizona in 1997. 99, now the medical school deans got together, so there were 8 or 10 of them that got together, developed consortium of academic health centers for integrative medicine. And it was established after a meeting of medical school deans. Right now, more than half of conventional medical schools in the US are members of this. 1999, we had NIH became interested because they want to do research. Because, when you look at how many patients are using it, there was a landmark study came in JAMA saying so many patients are using complementary therapies and we are not paying attention to it. And so more interest was developed in researching it. So 1999, so it's not that long ago, is when NCCIH was developed. 2010, now we have American Board of Physician Specialties Board certification was developed. So first official board certification in integrative medicine for MDs and DOs. 2013, Academy of Integrative Health. So ABIHM became, AIHM. So it was a board, but now it became an academy, and it's an international academy of integrative health now. And then interprofessional fellowship in integrative health and medicine was developed in 2016. Next, another one word you're going to hear is functional medicine. And the reason I'm bringing up all these is these are all parts of clinical care within whole health. So, one has to understand these before you go into the whole picture of whole health. So functional medicine model is individualized, patient-centered, science-based approach, which empowers patients, practitioners to work together to address underlying causes of disease and promote optimal wellness. So this one is more into genetics and biochemical changes, lifestyle factors, and it leverages the data. It goes deep into diagnosis, and after that, it comes up with lifestyle treatment options most of the time. And we can use natural supplements as well if needed. Founding of functional medicine. So this was started again by Dr. Bland. So these guys were biochemists, So 1991, Dr. Jeffrey Bland founded Institute for Functional Medicine, or IFM. 93, first International Symposium was held. 98, AFM-CP course was offered for the first time. 2001, IFM became nonprofit. And 2014, IFM collaborated with Cleveland Clinic to create Cleveland Clinic Center for Functional Medicine, which is publishing now and has very positive studies, large-scale studies they are doing. Yeah. So the result is comprehensive whole person approach, to treat the root cause of disease and restore health function. This is the tree of functional medicine, if you look at this. So here, most of the time, traditional medicine works here. So what do you come for? What are your signs? Let me examine you, what are your symptoms? And then we examine, okay, well, these are the signs, and this is the physical exam. And then we say, this is the organ system diagnosis. You need to see a cardiologist or a pulmonologist or, a gynecologist or a urologist. So this is how traditional medicine works, right? But if you look here, this is the organizing systems of core imbalances. Your imbalance could be assimilation, like it could be communication in the body, like how's different hormones talking to each other, how's the body assimilating the food that it's getting, how's it getting rid of the stuff, like how's it detoxing itself. So these are the fundamental organizing systems and clinical imbalances. This goes more similar a little bit to, I would say, Ayurveda, because Ayurveda talks about this. Yeah. We talk about, Vata, Pitta, Kapha, right? So it's kind of something similar. We're talking about clinical imbalances, more physiology-based. Then antecedent factors. What are the triggers? What are the mediators? What started before you had the disease? What led to the disease? And what are the things which is continuing the disease process? What are the other things which are predisposing you to these things? So what are the genetic predispositions? It could be even experiences, attitudes, and beliefs. If you're a positive person, you somehow heal faster, so because, your body kind of responds to it. And positive affirmations are very useful. And then we have the foundational things, which is, all our foundational things are, sleep and how do we eat, what is, how much exercise we do. Also, environment pollutants, they can affect us in many ways. Microorganisms, infections can even lead to cancers. We know, there is Epstein-Barr virus is associated with so many different cancer, triggering different cancers. And so this is the functional medicine tree. Lifestyle medicine, that's the newest kid on the block. So lifestyle medicine started recently. So this one is traditional doctors said, hey, we like it, but we can't accept everything. So what should we do? We'll just pick the lifestyle piece, So they just picked up the lifestyle piece, and that's lifestyle medicine. So this includes the therapeutic lifestyle interventions as primary modality for treatment of chronic conditions, which is not limited to cardiovascular disease, type 2 diabetes, or obesity. Evidence-based, whole person, prescriptive lifestyle change to treat and when used intensively, often reverse these conditions. So they use basically 6 pillars of lifestyle medicine. So whole foods, plant predominant eating pattern, which we do that in India anyway, physical activity, restorative sleep, stress management, avoidance of risky substances, which means don't take drugs and risky things, and positive social connection. So these are all effective interventions. And so this has become the fastest growing, I would say, integrative education right now. So founding started in 2004 and now has more than 9,000 active members. It's a much shorter training. It's like about total 100 hours of training. And so it's easy to do as well, but after that, people are able to incorporate that in their clinical care. So what is the key point? They're all whole person care. They emphasize on biopsychosocial determinants of health. They're open to all modalities, which can help our patients have some evidence behind them or they're low risk. There's advocacy for the patients. There's some altruism, focus on prevention and wellness, similar to public health. They're patient-centered, not disease-centered. And scope of practice is wide in all of these. Now we come to VHA, Whole Health System of Care. So this was founded in 2015. And, I, in fact, was in the VA at that time. And 2012 is when I got certified in integrative medicine. And I was hearing some rumblings like VA is doing something to do with whole health. I was like, what are they doing? And then the whole structure, came together in 2015. With a very structured implementation plan, and also assessment plans, so that we can assess what it's actually doing. So that's where we learned how to do, population-based research, in whole health. So problem-based disease care system to patient-centered healthcare, partnering with the patient to empower them and to equip them to take charge of their health and well-being, to live their life to the fullest. I love this one. To live their life to the fullest, and changing the dialogue from what's the matter with you to what matters to you. So National Academy of Medicine, based upon all the evidence that has come through since then, since 2015 to now, from all the flagship sites, in the VA and other design sites, they basically said whole health is the approach which holds great potential for addressing major challenges in healthcare workforce well-being, that have only intensified in the recent years. So shifting to this approach puts a renewed focus on diverse teams that work together to provide integrated care, improves efficiency, mitigates burnout, reduces strain on our healthcare workers. And it focuses on social determinants of health, institutional barriers, other roadblocks to achieve well-being. And so basically it's like the next moonshot for preventive care. This is the data from flagship sites. Flagship sites are 18 flagship sites nationally in the VA. VA has integrated networks. So we have 18 networks. So each network had one facility that got a lot of money and got researchers, and they were able to collect all the data on whole health as it was implemented and review the data. So they found that since 2017, 193% increase in complementary therapies and whole health core services offered under the pilot amongst veterans with chronic pain, 211% increase amongst veterans with mental health diagnosis, 272% increase amongst veterans with other chronic conditions. So veterans who used whole health services had better perception of VA care. Veterans who used whole health reported more engagement in care and life. Veterans who use complementary therapies and whole health services reported improvement in their well-being. Largest decreases in opioid use were observed amongst the veterans with chronic pain who were core whole health intensive users. So they had 38% reduction in use of opioids. And those who were comprehensive core whole health and CIH, which is complementary integrative health users, compared to those who did not use the services, which was 11%. So clinical staff who were more involved with the whole health were also less likely to resign. So people who were providing care were also happy. Led to less burnout, because they felt there was less moral injury. What they were doing matched more with what they came in medicine for to start with. Greater employee involvement in whole health activities were positively related to patient perception of patient-centered care as measured on SHEP scores. So SHEP score are the patient satisfaction scores in the VA. So there was improvement in the patient satisfaction. And there was also more employee involvement, which positively led to hospital system performance. And this was captured by SAIL measures. So SAIL measure is the hospital's quality measures. So they also got better. So this is the circle of whole health as defined by the VA. So we are in the middle with our mindful awareness. We have 8 circles of health here. You have working your body, surroundings, personal development, food and drink, recharge, family, friends, co-workers, spirit and soul, power of the mind. These are all self-care circles. 80% of our health lives here. Then we have conventional and complementary approaches here. We have prevention treatment here. And then we have the community that supports us, that makes your circle of whole health. So we are self-care, professional care, and community makes whole health. This is the other circle of whole health, which is the, how whole health is implemented. So we have the pathway, which is to empower our patients. You partner with the patients to discover their mission, aspiration, purpose, and you create an overarching personal health plan so that they can work on. So we develop SMART goals, which means, they have to be specific. They have to be measurable, So as you know, SMART, just like in engineering, we use SMART goals so that patients can follow through with those goals and their coaches and peers keep them up with them. Then we have well-being programs, which include self-care, skill building, support. We have complementary integrative health. Then we have health coaching, health partner support. So that comes in our well-being programs. And then we have whole health clinical care, which is treatment. So outpatient care, inpatient care, it can be implemented everywhere. Health disease management with within a whole health paradigm, which includes personal health planning, includes complementary integrative therapies, includes health coaching, healing relationships, healing environments, and the community completes this circle. And I can tell you, I'm very pleasantly surprised myself, being a, evidence-based person. I was like, I don't know, I just started my whole health clinic, and does it really work? Just this week, I had a patient who had refractory hiccups for 4 years. Nobody could treat him. He got every treatment you could think of. I saw every specialist you can think of. Finally, what worked for him? Mindfulness, learning how to improve the vagal, the vagal forces as compared to the sympathetic drive. Abdominal breathing. I taught him the breathing of yoga, abdominal breathing, and we managed to fix his chronic refractory hiccups without a pacemaker. Otherwise, next step would have been a pacemaker for, the diaphragm, to help them with breathing. Personal health inventories. This is a starting point of whole health. So what really matters to you in your life? Isn't it very profound? It's very hard to know. I don't know what really matters to me in my life. Sometimes I have to think, and it changes over time. Things that matter today, may not matter in 2 years, What brings you a sense of joy and happiness? That also, as we grow, as we evolve as humans, as we age, that also changes. And I think it's very important to understand that as we develop care plans for our patients. In personal health inventory, where are we on physical health? How are we in mental health? What is it to live our life day to day? So we ask them to rate themselves from 1 to 5 in all of these. Then we look at, in each of those circles, where are we and where do we want to be, right? So moving the body, recharge, food and drink, personal development. So all these things are important, right? Family, friends, co-workers, spirit and soul, so 8 circles. In each one, where are you now? Where do you want to be? Why do you give yourself that number? And what could you do to help you get there? So here we are using motivational interviewing techniques to help our patients figure out what do they really need to do. So by the time we are done, they already have a plan as to what they need to do. So current and desired states, again, surroundings, power of the mind, we talked about those. And then, then also prevention clinical care. There's some people who don't even see a doctor, like, hey, you need to see a doctor because maybe there is something wrong that needs to be taken care of, And did you get your vaccines? Did you get your cholesterol checked? Did you get your screenings done? Did you get your teeth cleaned? So all those are important things. So reflections, not that you've thought about all these things. What is your vision of your best possible health? What would your life look like if you had that health? What would you do? Wow, you want to climb Mount Everest? Yeah, maybe, well, you have to exercise quite a bit. You have to eat this. You have to strengthen yourself to get there. So where do we want to start, right? So where would you like to start? What do you want to work on? So that's where we start. A lot of times it is like, I want to be able to take care of my grandkids, Well, then you need certain level of health if you want to be able to take care of your grandkids. This is what a personal health plan looks like. If you see in this one, they have the areas of circle and, what is your plan? So basically what would you be, what is your mission, aspiration, purpose? What are your SMART goals? So pathway, as I mentioned, health coaching, peer support. We have group visits, taking charge of your life and health. We work on personal health inventory in group setting to start working on goals. Well-being programs. There's a curriculum for each smaller circle. Then we have movement activities, qigong, yoga, movement class, mindfulness. Then we have healthy teaching kitchen. These are the 9 tracks of wellness activities. As you see, all the circles are a track, and then personal health planning is another track. Foundations of whole health clinical care. So all these are foundations, right? We talked about whole health overall overarching structure, which is a big umbrella, biopsychosocial model of care. It includes integrative medicine, functional medicine, lifestyle medicine, and in its well-being section, and also in its clinical care section. Then behavioral health interventions such as cognitive behavioral therapy, and then social work, rehab, rec therapy, all of those are included. What is the vision of whole health clinical care? So it's a culture change. It's not easy. Hospitals which are used to doing what they do, they want nothing to change. Yeah, they love it the way it is because sick people keep coming and they keep, churning them in and out. But people are getting sicker and sicker. That's the problem. Yeah. So we have to do patient-centered, integrative, comprehensive, compassionate care. Also, the hospital should not be a place that you walk in and you cringe. It needs to be a relaxing therapeutic place, right? It should be patient-centered clinical care, which emphasizes patient engagement. The patient should be ready to go. Yeah, I'm going to do these things and I'm going to get healthy, and patient participation. It includes both traditional medicine and evidence-based integrative modalities. It should be multidisciplinary. We can do individual visits. We could do group visits, and different people like different things, many times you're going to find women like more individual therapy and men like group visits, so you're going to find all sorts of research in that. And in fact, we did research on that particular topic. Implementation in all settings of healthcare from inpatient to outpatient. And this is empowering the patient with mindful awareness, mindful, me, awareness of me. And then, if you look Pema Chodron's, you are the sky, everything else is just the weather, right? Between stimulus and response is a space, and that space our power to choose our response. So in our response lies our growth and our freedom. Food is medicine pyramid. So if you look at this pyramid, so here is all the things as we are going more in that direction, all the way from population level health food policy programs to government nutrition security programs to food produce prescription programs, medically tailored food packages, and medically tailored meal programs. All of those is an evolving frame, Integrating food is medicine into healthcare. So there's a 5P model, purchasing healthy food for hospitals, partner to support enrollment in federal food nutrition assistance programs, promote changes to regulations. It's already happening in Texas. Actually, they just changed those rules this month. Yeah. Plant foods on, healthcare premises, prescribe foods in addition to medications. And Geisinger has done that, with good results. And Mayo Clinic is looking at that. Complementary approaches. So this is the CIH directive list one, which have evidence for them. These approaches by Undersecretary of Health in the VA, we have to pay for these services in the VA for the veterans if they clinically need it, which means they all have enough evidence based upon query, which is the large research body in the VA that does meta-analysis. So meditation, mindfulness, acupuncture, yoga, tai chi, qigong, biofeedback, hypnosis, massage therapy, and guided imagery. They all have enough evidence that VA has to pay for it. This is kind of my own idea of what outpatient care should look like. So personal health planning, we should have integrative chronic pain management programs. We should have survivorship programs. We should have integrative medicine consult service. We should have a Thrive program so people can figure out what is important for them, not just to survive, but to thrive. Population specific, it could be disease specific. It could be women only and men only, or it could be people who have metabolic disorders or cancers, Integrative nutrition, food as medicine, Dean Ornish cardiac rehab program, and different complementary modalities. Inpatient care could be perioperative surgical home, in which we could use Reiki and acupuncture. You could use music therapy, inpatient setting. We could use virtual reality in inpatient setting. So all sorts of things can be done. Environment of care changes, make it therapeutic environments, not just cancer centers, but all hospitals should be like that. Whole health for employees, we should offer similar things for people who work there, who put their life's work into taking care of others. We need to support them. And we also need to have blend groups, and we need to have wellness officers that actually pay attention to what are the logistical problems which are making our life hell, working in big systems. We need to have good EMRs. They need to work for us. They should not increase our work for 3 hours a day. They should actually help us reduce the time we spend. So educational activities. So these are all the different activities which are available, in the VA system, which also includes battlefield acupuncture. So it's protocolized auricular needling, which has very good results actually for pain management as well as stress reduction. And it was used in the battlefield for the longest time, and now is being taught to VA providers. This is Washington State, Skamania. Whole health research. So how VA whole health coaching can impact veterans' health and quality of life. So this was a mixed methods pilot program evaluation. So here, again, it's a positive study. And so you can have, whole health coaching can lead to meaningful progress towards health goals, reduce stress, and improve quality of life. Examining relationship veterans' use of VA whole health services and mental health treatment. So they found that veterans who used whole health were more likely to engage in evidence-based psychotherapy. We want them to do that, right? So start them with whole health. Utilization outcomes of whole health model of care by veterans with psychiatric illness. So whole health programming shows promise to reduce suicide risk and need for mental health services amongst this population. Whole health use interest amongst veterans with chronic pain and PTSD. So early implementation efforts led to high rates of use of core whole health and CIS therapy use amongst veterans who had these co-occurring pain and PTSD. So we need to look at how well they are meeting their, needs. So there was interest amongst veterans to use whole health. Determining whether complementary integrative health approaches are associated with pain care quality in primary care. So this is, again, this study found that incorporating CIH approaches may reflect higher overall quality of care for veterans with musculoskeletal pain seen in primary care. Understanding veterans and provider perspectives on impact of telehealth whole health services. So this is synchronous telehealth for monitoring disease, increasing access to healthcare. So it found that veterans and providers perceived whole health services provided via telehealth to be a strong complement to in-person services. Use of whole health services amongst veterans with spinal cord injuries and disorders. So again, participation has been increasing amongst veterans with SCI, but overall use is still low because these are really sick patients, and so targeted efforts to increase whole health programming is needed for this particular population. That's just my photograph of the Green Lake in Syracuse, New York, that I absolutely adored. Whole health research, so integrating peer support and whole health coaching with primary care to address healthcare needs of homeless veterans. So here also, the study tested a novel intervention which features peer specialists and whole health coaches that coordinate with primary care team to reduce homeless veterans' frequent use of acute care. So this one was a useful study to reduce homelessness. Assessing effectiveness of VA's whole health model of care and reducing opioid use. So this veterans with chronic pain who use whole health services had greater reductions of opioid use, as I mentioned, minus 36%, as compared to those who did not, who had 11% reduction. Assessing changes in veteran-reported outcomes associated with use of whole health in VHA's National Demonstration Project. So it found that veterans with chronic pain compared to those who did not receive whole health services, those who received whole health services reported greater improvement in patient engagement in healthcare and self-care. and their experience of care as being more patient-centered. Understanding who uses whole health, So this was one of the studies we did in Syracuse. And so women were more likely than men to use individual-only whole health services. High utilizers, top 30% of the sample, were more likely to attend groups than the remainder of the sample. Adapting a whole health model to home-based primary care. So yeah, now we are looking at, how can we improve, the model of care for patients who need care at home. So these are veterans with complex medical issues, and it kind of addresses the unique needs of healthcare teams that provide in-home services to medically complex veterans and offer suggestions for enhancing self-care and preventing burnout. So VHA's whole health system of care, supporting health, well-being, and resilience of employees. So VHA's shift to this patient-centered model is supporting not only veteran care, but also employee health and well-being. Acupuncture and whole health. So in 2011, 42% of VHA facilities are offering acupuncture. Right now, 88% are offering acupuncture. And so basically, a lot of acceptance of acupuncture within, the VAs. There's a trial of whole health team versus primary care group education to promote non-pharmacological strategies to improve pain functioning, quality of life in veterans. So this is basically a part of the pain management collaboratory, which seeks to create national level infrastructure to support evidence-based, non-pharmaceutical pain management approaches. So this study is going on, basically. So they're comparing the whole health approach versus primary care approach. Whole health systems of care in the community setting. So here we have role of family physicians in development of integrative medicine and whole person care. So Samuel Lee Foundation and Family Medicine Education Consortium were quite involved in developing whole person care models. So they established a year-long virtual integrative health learning collaborative. To test its implementation, they created like a Hope Note toolkit for private practices. And it was implemented in federally qualified healthcare centers, family medicine residency programs. They were urban, suburban, rural. So basically it had a patient's survey, personal health inventory. So instead of using a SOAP note, which is subjective, objective assessment plan, they use Hope Note to understand patients' values, life goals, and understand their personal needs for healing. And so this was a positive study. So 16 clinics completed this. It was 220 clinicians and about 39,000 patients. And then, 91% of participants agreed or strongly agreed with the statement that they liked the PHI. 83% agreed with the statement that the PHI was easy to use. And most clinics plan to expand its use. So it's doable in the primary care setting. Integrative medicine for the underserved. So this is another one, which is a nonprofit organization founded by a small group of very committed family medicine doctors who provide care to the underserved. And they feel that integrative medicine is the key to reducing healthcare disparities. Various trainings and fellowships which are available, within, in integrative medicine. So ABOIM, ABHM is now done. It's become the academy. IFMCP is still available. It's growing even bigger. ACLM, acupuncture, battlefield acupuncture, whole health training, Reiki, heart math, neurofeedback, health coaching, hypnosis. All of these are options. And these are all the organizations that are supporting integrative medicine right now. Wellness and self-care, self-awareness, self-monitoring, psychological well-being, spiritual well-being, our hobbies, readings, life passions, community service, travel, medical care, preventive care. We all have to do that, right? Doctor of the future will give no medications, but will interest patients in care of human frame, diet, and in the cause and prevention of disease. Thomas Alva Edison. We are going back to that statement. These are all the different reference links, including NIH's website and Total Force Fitness. If you want to read on that, there's Dean Ownership Programs information. There's a lot of data on whole health, the national data. There's also the National Academy of Medicine's big paper, which is about 400 pages. That's all. That is my presentation, and I'm open to questions.
Hi, ma'am. I'm Dr. Nandini, and I've graduated from India. So, what I would like to ask is, when you discussed about like working in groups, you said when dealing with patients, like, could you elaborate on that? Like,
Absolutely, yeah. So there is different types of group visit models. Our health coaches and peer support specialists, they use taking charge of your life and health, in which they go through each circle of wellness with the patients. And then they help them do their personal health inventory so that the patients kind of sit down together and they kind of fill what is important to them, where they are in each section, where do they want to be, and if they have any questions, we can address those questions, with the coaches. They also kind of get our patients more abreast with what clinical care is available to them. What can somebody like me offer them, in the whole health clinical service. So that is one type of group. The second type of group is a clinical group. So clinical groups are used. Thrive is a program which is done by providers, by physicians, a physician-led program. It started in Tampa, Florida, with Women's Health. And what they did was they'll have maybe 10 to 12 women in one group, and they will pick one topic each time, and they'll go through that topic. It could be it could be related to each circle of health. It could be related to even financial support, how to prioritize what is important, because many times we get overwhelmed because we have too many things to do. So they had that. They even had creative arts. They would have people sit down and do art together. And then we did a medical visit at the same time. If you have any medical issues, we can check your blood pressure, we can do the vitals, and if acute issue, doctor can take care of that. So it was like a group visit model, which also included a huge section of education. And the education was done by a psychologist, it was done by the chaplain, it was done by a financial advisor, it was done by a dietitian, physician, nursing. So all these people came and they tackled different topics on different days. So this was kind of a program which kind of lasted for a few weeks, and it would circle back. And many times what they saw with Thrive, there was reduction in depression, reduction in anxiety. The groups bonded so well with each other, they decided to continue meeting with each other afterwards. They became friends. So that was the Thrive. It started in women's health, and then it's being now modeled for other men's health. It's being also looked at for metabolic disorders. It's being looked at for different types of specific disorders. You can do group visits. Then our Dean Ornish cardiac rehab is a group visit model. All people come together and they meet in groups and they learn about meditation and food as medicine. All our healthy teaching kitchen is group visit. Multiple people come and they learn how to cook together. So there is a really fun part in that one. Many of the lifestyle medicine things, they are done in groups, and even for functional medicine. So each functional paradigm, assimilation or biotransformation, each one can have a group. And you can have people coming together in group for the education piece, and then we pull them out for their, actual, if we want to meet with them for actual visits for a short time in between.
thank you, ma'am, for that. Thank you.
So
Any
others,
other? Go ahead.
so others, if anyone is having any doubts, please feel free to ask her.
So if you see this picture, you see Ambulanza, this is Venice. Yeah, so this is the ambulance in Venice. Every country has its own flavor. Yeah, I think it's a lot of information. It kind of takes time to absorb all this information, and
Ma'am, I also have one more question. Um, uh, how long would this take to be, integrated into actual practice? Because this is all being at a starting level. I mean, it's still at the experimental phase, but how soon can this be integrated like into everyday practice? But
I
not
wish it
only.
would be, yeah. I wish it would be implemented within a year, but I don't think that's going to be the case. It's probably going to take maybe 4 or 5 years, I would say, at the minimum. But now that, every country has to figure out what its priorities are. And if it becomes a priority in the United States, I think it probably could be implemented within 4 or 5 years.
It was very interesting presentation. I'm glad. And just thank you.
Thank you.
Thank you, ma'am, for your inspiring words. So it was truly thought-provoking and inspiring words. So thank you for sharing your experience and your experience and insightful thoughts. Thank you so much, ma'am.
Thank you. Thank you. Thank you for your comments.
Thank you, ma'am. So if there are no questions, can we wind up the session?
I'm okay with that.
Okay. Okay, ma'am. Thank you once again.
Yeah. Thank you very much. And I'm going to end the slideshow. And thank you all for listening. And I think we should wish you all the best, for your journeys. And you have a great day.
Thank you, ma'am.
Thank you, ma'am.
Mhm.